Hello again. First, I would like to thank those of you who subscribed to my first video and made encouraging comments. I was talking about my investigation into the relationship between the mind and the body. Nowadays, the right of a child to a father is not a civil liberty that is held in high esteem by modern society. The consequence is leaderless, ill-educated youth running wild. The importance of the paternal role was well illustrated by my own father. I often think he taught me more medicine than I ever learnt at medical school, and he unwittingly set me on the path that has led to me talking to you now. He had been born and brought up in impoverished circumstances on a Scottish croft. His academic talents emerged early, so that under the Scottish educational system of the day, he was eventually able to go to Aberdeen University. But in the year that he qualified, his father died, bequeathing debts, which he set about paying off by doing locums in general practice all over the country. He could not afford to gain additional clinical experience in ill-paid hospital jobs. His mother was a devout churchgoer, and like all Scottish mothers of gifted sons in those days, she wanted him to become a minister of the Kirk. In deference to her wishes, he started his university career by studying arts. He thus became familiar with such disciplines as Latin, Greek, logic, and jurisprudence, and graduated MA before studying medicine. This broadened his mind and lent a sense of proportion to his clinical judgment. As he pointed out to me as a lad, although all cows eat grass, not all grass eaters are cows. He also taught me a little Plato, spelling out that there were three kinds of love: agape, or the love of nature, platonic love, or love of people, and erotic or sexual love. There is much more to love than sex. He never talked about his patients. Indeed, he seldom talked if nobody was listening, and I took after him in that respect. But as teenage curiosity developed, he was happy to talk about his clinical experience into the small hours after mother had gone to bed. This was in the days before penicillin became available other than by injection. Most medicines were still little more than coloured water. They did not cure cancer or heart disease or kill germs, but they relieved almost everything else. The medicines did contain some powerful and poisonous ingredients such as opium, chloroform, belladonna, strychnine, and aspirin, so that it was important only to take the prescribed dose. Patients came back for more at £0.50 a bottle. It made them feel better, and that was why they were prescribed. Father told apocryphal tales about these remedies. He spoke of a practice in Durham, where he had once worked as a locum. Only three kinds of coloured water were dispensed: pink for head and chest, green for stomach, and brown for bowels, I think it was. A similar routine was practiced in the army. I remember him talking about viruses and bacteria and how they were everywhere, in the air we breathe, on our skin, in our noses, mouths, and intestines. Infection depended on the number of invading organisms and their virulence, rather than mere presence. But infection also depended on the resistance of the individual. Part of that resistance was immunity. This could be innate, with some germs affecting animals but not people. It could be acquired, a result of earlier subclinical infection, such as immunity to tuberculosis or poliomyelitis. It could be the result of a previous infection, such as the diseases of childhood, mumps and measles and so on. Immunity could also be acquired artificially by vaccinations and immunizations, such as to prevent smallpox. The body has other defences. He talked about phagocytes, cells in the blood whose numbers increase dramatically in the presence of infection to devour trespassing organisms. That having gorged themselves, they died and turned into pus. He pointed out that fever could inhibit the growth of germs by creating unfavourable conditions for their reproduction, and that this effect was potentiated by bed rest. His teaching was later confirmed at medical school. But most important of all, he talked about the natural resistance of the body. This was weak in infancy and diminished in old age, but it could also be lowered by everyday circumstances, such as lack of sleep, missing meals and going hungry, getting chilled, getting drunk, a shock, and acute or chronic anxiety. That anxiety and stress could lower resistance later became obvious to medical students when they suffered boils or eruptions of acne at exam time. It explained why, in an influenza epidemic, for example, some people fell ill and others did not. It was clear to me that there was a psychological component to catching an infection. I've gone on long enough for now. I'll be back quite soon. Bye.